Doctor, I have a question for you, but before I ask it, there is someone who sent you here a message. He's saying, "Hi, doctor. My 9-year-old son has small balls. I think those are testicles.
Yes.
And a very short, I think, male part. Is this a problem as far as his reproductive life is concerned? He's tall and big and looks older than his age. Will his private the private part of
will it improve?
Yes. Will it grow proportionate to his body? I think she is Grace. I think she's Grace from Makinde. And then secondly, she's saying, about myself, I'm 47 years old and still receive my periods normally. Those are 6 days. But I get these hot flashes that I call symptoms of menopause. Am I wrong to assume so? I'd like to conceive once more, but had my tubes surgically blocked when I had my 4th child in 2014. Is it wise for me to have my tubes unblocked at my age?
Yeah, Grace, thank you very much for those questions.
Yes.
Yeah, starting with the little boy,
yes,
who has small size testicles, which is calling balls, and also I think he's describing that the penis is also small.
Very small.
Yeah, it's very small. Now, sometimes the causes of fertility issues are congenital. The person is born with it, and they may manifest in either delay in women, like for example to get into puberty. Of course, in my mind, also a boy can also have a delay to get into puberty, but also it can show as the genital structures being not developing well. Well, I'm not saying that the child has those issues, but this is a child who needs examination by the health worker.
Yes,
both the genital examination, looking at the balls and the scrotum and the penis have to be examined, and other features of some abnormalities have to be examined, because we do have some genetic issues which affect the development of the child as a whole, and also development of their reproductive system in specific. So
thank you.
Yeah.
And then her concern about to unblock her tubes.
She wants to unblock her tube. I think again she needs to be re-evaluated so that the management plan is drawn by especially a fertility specialist. She has to sit down with a fertility specialist so that they are able to draw a plan and to give her advice on what the best approach is.
I will.
Well, at 46, it's a good sign that she's getting a period. It could be that she may still be having some reserve of eggs, but whether it is logical to unblock her tube and to allow her conceive normally, or she uses some other approach, for example, IVF, has to be discussed with the doctor, because in that age range we have the risk of chromosomal or gene issues, and IVF probably will be a better option in that case, because then during IVF you can first check the genes of the embryos before you transfer. So that discussion has to be done with her doctor.
Okay.
Yeah, before she just rushes to try and unblock her tubes.
On her decision.
Yes.
Thank you.
Yep.
She's also saying, what would you advise as far as surrogacy is concerned? Please don't advise on best way forward. I need a child now. She's also thinking of surrogacy.
Yes. So yes, actually, just to explain, surrogacy is a form of fertility treatment where another woman carries the pregnancy. Now, the basic IVF treatment involves the doctor getting out your egg and getting your husband's sperm. One day we'll talk this in details here, but get out the sperm, get the eggs, get the sperm out, and these two are made to meet in the specialized IVF lab. And then from that you actually get what we call embryos. These are real babies, and then they are put in the womb, and they can
the
grow.
Womb of the woman? Of the mother?
Yes, of the mother.
Okay.
Now in surrogacy, instead of putting the embryo in the womb of the mother, for some reason we will explain, we put it now in another woman to carry.
Is it done here in Uganda?
Of course, we do it, and it's not a complicated science. We do it. We have been doing it for quite some time now.
Really?
Yes. So, when we do that, we are doing surrogacy. Now, there has to be reason. There has to be reason for as to why the original biological mother cannot carry her baby. There has to be reason. So we have to evaluate, are you having health issues? Is your womb okay, or it has issues? And so if we judge for this reason that you can't carry the pregnancy, and then somebody can carry for you. So it's possible to do that, but it has to be assessed.
First by the medics?
Yes.
Okay.
Yep.
Thank you so much for the responses. Grace, wherever you are, I think the doctor has given you back your feedback. Please, before you do or decide anything, seek for medical help from a specialized personnel. She's saying, thanks Teacher Zita for the show. What causes sperms not to have tails, and how can it be prevented, doctor?
Yes, so the report, as we said, analysis of the sperm is usually a detailed analysis which involves counting the density of the sperms, the population of the sperms, but also studying their shape, including the different parts, the size, the shape of the head, the presence, absence of the tail, the shape of the tail, yes, and their movement as well. Now, problems of the sperm, especially structure, like the one she's describing is absence of the tails, is a structural problem. Now, these problems usually arise from the development process of the sperm. And the development of the sperm goes through extensive stages, several stages. We describe a number of them now, but at some stage, the sperm has to develop the tail. If that stage is interfered with, either because of some diseases or because of some enzyme issues, somebody is born up without the certain enzymes, then the sperms will not be able to form the tail. And we know at what stage we say sperm formation is being arrested. Yeah, or sometimes if the sperm from the process is released before it develops the tail. So these are technical issues with sperm development. Yes, so structural issues with the sperm usually reflect abnormalities resulting from the formation process.
Okay.
Yeah.
Thank you so much.
But it needs, if you have a few sperms without tails, that may not matter.
Okay.
It needs to be more than 40% of the sperm without tail. That's when you become of concern.
Okay.
Yep.
Thank you so much.